Judy, would you like to ask a question, and where are you from?
Yes, I'm from Philadelphia, PA area. And I know that some doctors, including Dr. Esselstyn, have said as we get older, we don't absorb nitric oxide as well, nitric acid, I'm sorry, as well from our vegetables. Dr. Esselstyn's recommended adding vinegar. Some other doctors have recommended supplements. Just wondering what your thoughts are on this.
Yeah, those are all good things. And, adding vinegar to your greens, I think is good. It certainly can add flavor. More greens is good. We use an L-citrulline supplementation for patients, which, we also use infrared sauna therapy, which is a way of improving nitric oxide production. We also use ozone infusion therapy. It's right, as the body gets older, there's a breaking down process. And I think and that's why I alluded to earlier, in our practice, we're using more other adjunct therapies to sort of help enhance the body's physiological function. And even stem cell, mesenchymal stem cell therapy can be helpful in certain cases. Ozone therapy helps the body create more stem cells, which helps repair a lot of the chronic breakdown and inflammation and improve cellular function. So the so-called, aging process or debilitation with aging is a debilitation with a chronic breakdown process, a chronic buildup of toxins. We should be, converting these molecules as effective in older ages as we're in younger ages. So we need to look at other things, and that's the small percentage where we say, okay, nutrition, we may overestimate nutrition alone because, we need to look at how much the body's broken down and consider other adjunctive therapies to enhance the body's ability to repair itself in addition to the food.
All right. Well, thank you, because I'm in that over 60 range, and sometimes from the vinegar I get like a lot of like mouth canker sores and things. So I want to try to cut down on that.
Yeah, you may consider, people, we have our patients do things like infrared sauna therapy, which is an excellent adjunct to help move toxins out of the body by sweating. It helps the body produce nitric oxide, improve circulation. There's clearly data showing benefits for people with coronary disease. And that's finished data showing with people with coronary disease having improved survival, long-term survival with 3 to 5 20, 30-minute sauna treatments a week. There's data out of Japan showing benefits for patients with heart failure in just as short as 2 weeks with a 2-week, 5-day per week treatment regimen. So infrared sauna has been shown to be helpful as well. So there are other modalities beyond just the food that will help your body enhance its overall functioning.
Thank you very much.
Welcome.
Dr. Montgomery, we are very focused on heart disease and stroke. Do the same things that cause heart disease and strokes also cause problems with sex drive or erectile dysfunction?
Yeah, these are all things that are biochemical imbalance. And we think of these things in terms of vascular abnormalities. And that's true, but it's more than just vascular abnormalities. These things are toxins that build up that in the system that contributes to hormone imbalance. So all of these things and libido's multiple factors, not just hormone, there's probably neurological components that contribute to that. So there are a lot of factors that electrolyte, zinc deficiency can contribute to testosterone deficiency. So there are a lot of things that contribute to this, these factors that are multifactorial, not just from the standpoint of poor vascular. So when we think of heart attack and stroke and erectile dysfunction, we think of vascular abnormalities. But we also have to step back and broaden the scope and say it's biochemical abnormalities in general. Because a heart attack and stroke, again, there's systemic biochemical things that contribute to these things as well. You talk about things like hormone balance, toxin buildup at the tissue level, so on and so forth.
What about the sort of new vegan burgers, the Beyonds and Impossible and other pea protein burgers, is this an improvement over animal products, or is it still too processed and causes similar problems?
If you ask if they're an improvement over animal products, it depends on the perspective. So if you say, well, we're not killing animals and we're eating these things, it might be an improvement, but I think you're still killing animals. Maybe the cows are doing better, but the humans are not doing better. So like if you kill the cow and feed the cow to the human, maybe you're killing the cow and the human. But if you don't kill the cow and feed the human the Impossible Burger or Beyond Burger, you're only killing the human. So maybe it's better because you're only killing one animal, but somebody's, catching it. And so I don't like these, processed foods because it's the processing of food. You can take, forget about the overly, laboratory manufactured Beyond Burger and Impossible Burger. We can see how those things are problematic, all the things you're putting in it. Just take a carrot or a piece of broccoli and batter it and fry it, then that broccoli has been turned into a toxin. So a toxic food by definition is toxic, whether it's an animal source or a plant source, it's a toxic food.
There are people that eat what they call a carnivorous diet. I guess it's all meat. Have you had any real world experience of what happens to people who follow this type of diet for an extended period of time?
No, I haven't. It sounds like, the ending of a horror picture show, I've heard people report these things. I just don't. I would like to look at some data. I haven't had time to research that. I've heard, and it's only recent. We're all familiar with the keto diet and various other high meat, high fat diets. But even those diets allow for vegetables. They just remove, processed carbohydrates. My understanding of the keto diet is that, they don't promote any vegetables. Now, I could be wrong, but, I've heard certain people recommend it. It's just all meat. And I guess maybe there's some eggs, I'm not sure, but, that's a pretty aggressive animal driven diet. Now, I've heard people talk about eating those foods and I guess they're still allowed to talk about it. I just don't know of any long-term data supporting it.
I think that what we're talking about is the carnivorous diet. The keto diet, I believe, does include vegetables. It's the carnivorous diet that's all animal products, just only.
That's right. Yeah, that's what I'm saying. The carnivorous diet is one that's fairly new. I say we're familiar with the keto diet, which has high meat and fat and allow some vegetables. The carnivorous diet is even more extreme. And I was making a difference between the two, meaning that even the keto diet, I can see how that could be beneficial because there's still plant foods that are there. The carnivorous diet, it's very difficult to see that. Now, oftentimes people talk about Eskimos and, Eskimos, they eat a lot of, whale blubber, whatever. They're probably getting some of the algae from the guts of the fish that they're eating. And maybe they're getting some greens, and maybe the keto diet's giving you some trace amounts of, plant foods from if you're eating the intestines and organs of the carnivorous diet, rather, is giving you some trace amounts of nutrients there. But I just don't, I'm not aware of the long-term data or if there's any long-term data on the carnivorous diet.
Do you ever recommend bariatric surgery for people?
I'll have to say extremely rarely. I can't think of a time where I solely recommended bariatric surgery. Now, frequently patients will come to me to get clearance to undergo bariatric surgery, and then we'll do cardiac evaluation and determine that the heart is strong enough to undergo general anesthesia. They would say they're clear to go surgery. That's not a point blank recommendation. So really, I have to say I almost never recommend bariatric surgery. I only do cardiac clearance for it, and that's when the patients already decide they want to have it.
I know you are a cardiologist, but do you have any input on whether or not we can prevent cancer?
Cancer is multifactorial disease. Obviously, like any disease, there's a genetic component, but there's a huge environmental factor. I mean, certainly bad food predisposes to cancer. Lots of people throw the percentage around 70% or whatever. Whatever that number is, there are other environmental factors that are contributing. So, toxins in the water, estrogen. And so that's why we need to be more mindful of what the chemicals that are building up in our bodies are. Women wear makeup and hair products on a regular basis. We put different types of things on our body. We may moisturize ourselves with Vaseline or whatever. I don't know what it is, but there's these toxins that are getting our system, our cleaning products. We're using certain air fresheners and the like, certain things that we dry our clothes with, that get on our clothes, the actual clothes we wear. So we have to start being mindful of these things. We talk about this so-called magical cure to cancer. And maybe this magical cure to cancer is for us to, both individually and collectively in the medical society, say, let's start to take a global look at the toxins coming into our system. Consuming a whole food plant-based diet removes a major set of toxins, especially when the processed carbohydrates being removed and animal products being removed. But the other chemicals and toxins that need to be removed as well, even the plant foods that we're consuming, how they're grown and what they're exposed to chemically. And then the products we use in our house, the products we use on our clothing, all that stuff. So we start to take a big global look at what our environment is. Then I think we can start to say, you know what, we can probably get a pretty good handle on preventing a lot of cancers if we start to say, hey, we're getting a lot of toxins in our system. Let's start to remove these things systematically.
What is the absolute worst food we could eat for our heart?
Oh, goodness. A double cheese bacon, a double meat bacon cheeseburger with a donut in between the double meat. I think I've covered my bases pretty well.
Okay.
And then one of the patties being an Impossible Burger.
Okay. Let me squeeze in one final question. Rita, would you like to ask a question, and where are you from?
Thank you, Stephen. I'm from Long Island. Dr. Montgomery, one question. For the swollen feet, nothing is wrong vascularly. What is one supposed to be doing if it is untreated? Because 3 times the vascular surgeon says it's okay, just leave the way it is if you don't want to take the if a patient doesn't want to take a medication. What are your thoughts? Just leave the way it is?
Well, if someone has swollen feet, again, any abnormalities is a signal. So, for instance, we look at abnormalities and we think of it 2 different ways to say, well, your feet's swollen. If they're not bothering you, don't bother them. And we do all of our basic tests. We may check for blood clots, and then no blood clots. We may check renal function fine. There's no overt heart failure. There's no whatever. And maybe there's no venous insufficiency. And so we say, okay, well, we didn't see anything, so, forget about it. I don't take that attitude. So, that things, just because we don't see things doesn't mean they're not there. And there's certain things that exist at the tissue and cellular level that cannot be picked up by our blood tests and cannot be picked up by our diagnostic imaging studies. And so then you have to get into the process of analytical thinking, because if something, doctors, we make good use of the tools we have, the blood tests and the imaging studies, but sometimes we fail to use the tool between our ears, which is our brain. And sometimes you have to, be analytical about it. So, for example, if I'm faced with a patient with swollen feet, maybe the kidneys are not totally normal, but there's some other aspect of it. Maybe there's a little inflammatory marker is a little bit off, et cetera, et cetera. Maybe the patient's history, some things, and how did the swelling come on? There was a sudden onset. So you want to get a lot of other clues to then make an analytical assessment on the empirical data. It's not going to be a test that you pull it out like a pregnancy test. It's like, okay, a slash or a plus or whatever. Medicine is not always that way. So we have to be like detectives and say, okay, what's going on systemically with that person? And what sort of clues may suggest underlying process that causes swelling? Because swelling is a signal as well as it is a symptom of something that's off balance or abnormal. So I wouldn't say just to forget about it. I'd say keep thinking about it and trying different things. And that's why I like to do raw detox diet, because at least local inflammation, different things like that will help the body clear itself up.
The detox?
Detox, we use detox frequently because poor lymphatic drainage may be the case. You may have poor lymphatic drainage. And we can't measure lymphatic drainage very well.
Okay. So the lymphatic massage does help.
Lymphatic massage often helps with that, but also nutritional detox help clean up the venous, the lymphatic system as well. So a combination.
Thank you.
Thank you.
Okay, so Dr. Montgomery, how can we stay in touch with you and follow up and get your books? What's the best way?
Well, my website, MontgomeryHeart.com, is a great place to follow us. That's the hub of all of our information. We have a new docu-series coming out. If you had a chance to see my talk, I showed episode 1. And Heart and Soul of a Champion, heartandsoulofachampion.com is the site, and there's a website showing that. And the reason I like to point to the docu-series, we've completed season 1. Season 2 is under production and will probably be released this November. It's chronic illness in women. Season 1 is athletes edition. So we got mostly retired football players. So you see a very narrow perspective of patients. But season 2 is chronic illness in women. But on our website, there's a lot of educational material. We have an online community. So many people from all over the world, from the UK, Australia, et cetera, are members of our community. In our community, you have access to things like recipes. We bring experts, similar to the experts you bring here, into the community where you can ask me questions one-on-one. You have exposure to me once a month on Stump the Chump, pretty much like what you're doing now. And people bring questions. We do case presentations. And plus you're interacting with a community of people who are like-minded. And so that's our community. We have online coaching courses, the FoodX Nutritional Rebuild course. That's an on-demand course. The Healthy Lifestyle Series course is a course includes the Rebuild on-demand components, and it also has other components. So there's a lot of information and material on our website. And just by reading the website itself, we talk about the essence of detox, what it means to detox, the food classification system. We talk about how we manage certain elements and the like. So there's a wealth of information there, and you can get in touch with us by calling our center. And people with a different spectrum of illnesses fly from all over the world to come and see us to undergo one of our disease reversal programs. So depending on where you are on the spectrum and what your needs are, we've tried to make something for you to help out in terms of, give you help in terms of reversing and achieving optimal health. Reversing illness and achieving optimal health.
Thank you so much for tonight and for sharing all your great information and knowledge from all your years of experience. I really appreciate it. And if we could unmute everyone else so other people could also have an opportunity to thank Dr. Montgomery.
Thank you.
Thank you.
Thank you. Thank you, Dr. Montgomery.